better image resolution, but the penetration is less. So they recommend the highest possible frequency should be used for imaging through the examination, because if the penetration is not required, you should be using the highest possible frequency of the probe. And of course the harmonic imaging that increases the resolution of the images, that they can normally we should use the maximum harmonic imaging to get the better resolution of the image. And what is the newer companies, what they have done, that they increase the harmonic images and reduces the frequency of the transducers, so that increases the penetration of the images as well as the increases the resolution of the image. So highest frequency of what is should be used in these studies. The other thing what they say is that the maximum frame rate should also should be used to increase the temporary resolution of the images, and which can be done by either we can reduce the depth of the images or increase the number of focal zones, or we can reduce the sectors. I'll come to each and everything, and using the pre-processing zoom. So this all will increase the temporary resolution to get the better images. This is a picture where we see that how sector difference can make the difference. When we take a white sector, we hardly see any color flow imaging. But just increasing the sector to reducing the sector, we get a better images. So this is how we should not be doing like this, and a properly taken sector definitely changes. So also the gain setting also, if we do a proper gain setting, the images are better, and we should always know about the instrument and the proper gain setting. For example, the Doppler also they have said that we should also know what are about the velocity scales. We should optimally use the velocity scales, the sweep speed normally at the 100 millimeter per seconds. We should have an adequate sample volume size. We should use the wall filters and the proper gain, and use the tissue Doppler imaging to get the better images. I'll come to each and everything. First and foremost is what is the measurement of the LV. That is more commonly I've been trained that way also, that we use the M mode across the LV and take the measurements of the IVS thickness, LV cavity and post-wall. It is now being practiced most of the things, but it has that M mode measurement has been changed long back, but we still use the M mode. So the recommendation is to use the 2D image only to measure the IVS thickness, LV cavity and the posterior wall. And the correct way of measurement is we should be taking as parallel as perpendicular to the thickness beyond the mitral leaflets, measuring the IVS thickness, LV cavity and the posterior wall. This is the way it should be done. It should not be an M mode cut. Similarly for the LA also, that should not be an M mode cut. As far as possible, direct measurements from leading edge to leading edge should be done. Normally it should not be an inner edge to inner edge that normally we do. It should be from the leading edge to the leading edge. And for the LVOT, a zoom phenomena is more commonly used to measure the LVOT annulus or the ascending aorta. And the correct time of, for example, the output tract diameter should always be taken in the mid systole, and LA should always be done at the end systole. This is how normally we measure. We should be measuring the LA. A direct measurement of LA rather than an M mode cut is preferable. And when we take an LVOT, this is a Plaque's view, and when we take the LVOT just before the origin of the aortic valve, that is where the annulus should be taken, and something 3 to 7 mm pre to the aortic valve is the LVOT. Similarly, the sinus and the sinotubular junction should be measured at the end mid systole to get the proper value and the ascending aorta. As a Dr. K.M.K. Reddy told, that very important is the how do we follow this pulmonary arterial hypertension, and normally a echo is a good parameter where we keep on seeing whether the patient is improving with the drugs that we are giving. So we should know know the accurate measurements of the RV cavities, the PA pressures and the MPA diameters, whether it is regressing with the therapy or not. So that should be also standardized. So the same operator, if he does, he of course he will use his own parameters, but when it is done by different parameters, the RVOT diameters and MPA diameters, they changes with the operator to operator. So they want to standardize everything. So when we report RVOT, there should be a proximal diameter and the distal diameter. The proximal diameter is the vertical from the aorta to the maximum diameter, and distal RVOT diameter will be just above the valve. Similarly, the MPA diameter should be calculated exactly between the valve and the bifurcation of the RPA and LPA. Midway between that should be the calculation of the MPA diameter. Okay, I'll just rush through many of the things. So the LV end diastole also be, this is the LV end diastole and the A4 chamber and A2 chamber should be done both in the diastole and the systole. And they always prefer that the color, the 3D echo should be used to measure the LV volumes and LV diameters for measurements. Similarly, the LA volume and RA volume should be measured, and this is also very important in the follow-up for the patients of PEH and all these things. I just wanted to know the color. They have also measurement that we should optimally do the velocity imagings to see the low flow situations, like when we see the IVC, the velocity should come down, and proper gain and proper sector is very important to get the good images. Similarly for the Doppler also, they say these are nothing new what we have been doing, and there is nothing addition. And they have given something on the agitated saline imaging which may be used to differentiate between the intracardiac and the extracardiac pulmonary shunts to differentiate, to know the agitated saline, and which is a bubble contrast where 10 ml of saline along with 9.5 ml of saline and 0.5 ml of air to be used for the agitated saline. The UA imaging, the very contrast when we are using, the indication was only when we don't get a good endocardial border. To enhance the endocardial border, that is the only indication where we are using UA imaging. But off-level indication can be used to see the cardiac mass, intercardiac thrombi, for enhancing the tricuspid regression signals or aortic stenosis signals. Strain rate imaging, nothing new for that. And so at the end of it, we should give a comprehensive report regarding everything, whether the patient's name, age, gender, and everything, and date on which the study was performed, and what's the referring physician's name, and what was the indication for that. That is often missed. Most of us we do when someone has just told the echo and we want to report it. And everything should be reported. If you have not seen anything, that should also be reported. This was not seen, and because of the images were suboptimal or impossible. So basically, to summarize, basically we should give 3 questions. All the answer question by the referring physician, which is not seen in our country, and emphasize all the abnormal findings. And if we can compare the previous echo findings, that should also be mentioned in our echocardiography report. Thank you.
Thank you, Dr. Saha. Due to paucity of time, we will not take questions probably. And then the next talk by Dr. Kondal will be postponed. And Dr. Seems, please, sir.
And Dr. Somaraju, sorry for interrupting. What interested me was your confession that we don't read echocardiography books. We don't read echocardiography books. So thanks for the confession. And when you lose clinical skills, the only thing that remains with us is a good echocardiography knowledge and skills. In the absence of it, the patients don't have diagnosis. So, will you want to answer it?
We should be spending more time with echocardiography. When you are reporting an echocardiography, definitely we should be spending, it should not be an haphazard report one. And definitely one should upgrade himself in the correct way of doing echocardiography.
So please say at least that we should read and also see the echocardiograms of our own patients and do it ourselves.
Yes.
And
Yes,
also a consultant, newly entering consultant, junior consultant who just finished, should continue to show interest and also get posted and learn echocardiography. Otherwise, they won't be cardiologists. Thank you.
Yes, I fully agree with you, sir.
Sorry, Dr. Kondal, your talk is postponed, and Honorable Minister is waiting outside for inauguration. We'll be making preparations for inauguration. After inauguration, probably we'll be talking.
Yeah.
We'll now wait for the inauguration. Thank you.
And now moving forward, we will proceed towards the inauguration ceremony, and to do the honor, I would like to invite Dr. Ravi Shankar. I would request Dr. Ravi Shankar to come here and do the inauguration proceeding. Can we all give him a huge round of applause, everyone?
Fourth annual CSI conference, Telangana chapter. I request our beloved President Syed Imamuddin sir to take over the chair. Now I request our executive members, our Vice President Adikeswar Naidu, Dr. Jochana, and our Secretary, Dr. Rajiv Garg, Dr. Nirmal Kumar, Dr. Mukherjee, Dr. Gokul Reddy, come to the dais. Now I request our Chief Guest of the Day, Itla Rajendra Garu, Honorable Finance Minister of Telangana State, to come to the dais. Now I request Guest of Honor, S. Venugopalachari Garu, to come up to the dais. Now I request everybody stand up for 1 minute for the national anthem. Janagana Janagana Jaya He Bharat Bhagya Vidata Punjab Sindh Gujarat Maratha Dravida Utkal Ganga Vinda Himachal Yamuna Ganga Utkala Jaladita Ganga Namasurami Jage Namasurasi Samage Jai Sabjaya Gata Jana Jana Mangala Nayaka Jaya He Bharat Bhagya Vidata Jaya He Jaya Thank you. Now, inauguration start. I request President to. Sorry for that. Now I request Tula Umma Garu, ZPTC Chairperson Karimnagar, come on to the dais.
so much, everyone. Kindly be seated. As now we have inaugurated this beautiful morning, I would request everyone to give a huge round of applause for this really wonderful, beautiful beginning of this morning. And now I would request Dr. Ravi Shankar to honor our guest, to honor our Honorable Minister, Itila Rajendra Garu. Can we all give a huge round of applause, everyone? Moving forward, I would like to invite Dr. Imamuddin to honor our guest of honor, Shri Benu Gopalachari. And I want everyone to give them a huge round of applause. May I please invite Dr. Uruj to present bouquet to Miss Tula Uma. Now I would like to call Dr. Ghazala to present bouquet to Dr. Imamuddin. A huge round of applause is needed. Now I would like to invite Dr. Nayala to present bouquet to our Vice President, Dr. A.K. Naidu. Once again, I would like to invite Dr. Uruz to present bouquet to Dr. Ravi Shankar. Huge round of applause. I want everyone to clap. Once again, I would like to invite Dr. Nayala to present bouquet to Dr. Nirmal Kumar. May I please call Dr. Ghazala to present bouquet to Dr. Rajiv Garg. And once again, I would like to call Dr. Uruz to present bouquet to Dr. Gokul Reddy. So can we all give a huge round of applause on this proceeding, everybody? And now over to Dr. Ravi Shankar.
Now I request our President, address the gathering.
Good morning, everybody. On this warm morning, we have a beautiful gathering. I welcome our chief guest, Honorable Finance Minister for Telangana, Mr. Itala Rajendra Garu, our guest of honor, Dr. Venugopalachari Garu, our distinguished Tula Uma Garu, which is than all our guests and senior cardiologists. We have organized this fourth annual conference of our Cardiological Society of India, Telangana chapter. Sir, we have been doing this activity every year for a long time, and since bifurcation of our state, this is the fourth conference going on. This is a non-profit organization, is the teaching body who organizes a lot of teaching programs and community health education programs. We thank you very much for honoring this occasion here. And now I call upon our guest of honor, Mr. Venugopalachari Garu, to give a few words.
Good morning all prominent cardiologists, those who attended the 4th annual CSI conference at Hyderabad, 4 years old of the state of Telangana. And this occasion participated chief guest our Honorable Finance Minister, Itala Rajendra Garu, Adarniya Umaji, Dr. Syed Imamuddin Sahab, President of the Telangana chapter for the CSI conference, and Dr. Sai Ravishankar, and Dr. Adikesha Naidu, Dr. Jayakumar, Dr. Raju, Dr. Nirmal Kumar, Dr. Ravishankar, Dr. Mukherjee,